This is the third course in the EDS Awareness Nursing Continuing Education Program, What the Nurse Needs to Know About Ehlers-Danlos Syndrome. My name is Melinda Baker. I've been a nurse for about 35 years and have a doctorate of nursing practice in adult gerontology. My clinical specialty is primarily critical care. It's more specifically most of my experience in cardiac surgery. My experience also includes staff education, quality assurance, and nursing education. Despite my years of nursing experience, what qualifies me the most to speak about EDS is not my professional credentials and experience, but rather my personal experience of being a caregiver and advocate. Now meet Maddie, my youngest daughter. She was diagnosed with hypermobile EDS approximately 6 years ago. We'd like to share what we've learned through our journey from onset of symptoms to diagnosis and beyond. During this course, you will hear Maddie's story. She is now 22 years old and was diagnosed with hypermobile EDS approximately 6 years ago. Her story is her own. However, the experience that she has had is not unique to someone with EDS. The themes of her story are very common when you hear others' stories. I hope that you will really hear her and consider your own attitude toward those living with these and other conditions that are not well understood. I hope that you will set aside bias about those living with chronic pain and help find solutions and provide encouragement to patients like her. This course is less about evidence and more about experience. Thank you for taking your time to learn more.
My name is Maddie Baker. I'm currently 22 years old and I was diagnosed with HEDS when I was 14. My story is not unique when you hear other patients speak of their experiences. However, for me, the 10 plus years from my first notable symptoms to diagnosis seemed very lonely, scary, frustrating, and isolating. My initial symptoms mostly manifested as GI issues, with what I now recognize as some POTS and mast cell issues thrown in the mix. After doctors ruled out an exhaustive list of common issues, it was decided that I had some sort of amplified pain syndrome. Some medications and lifestyle changes helped for a while. My symptoms intensified during my 8th grade year of school with some severe allergies, a symptomatic pectus excavatum, abdominal pain, and joint pain. During this time, many of my healthcare providers that I encountered made me feel like I was crazy. After all, if a 14-year-old girl has abdominal pain and it is not appendicitis, she must be pregnant. There was a bias that blinded them. When they couldn't find what was wrong, what they expected was wrong, they made me have multiple psychiatric evaluations because they were convinced I had an emotional trauma with physical manifestations. The abdominal pain was actually a bowel malrotation that resulted in 2 bowel surgeries. Time after time, I told them what was wrong and they wouldn't believe me. It was never what they expected. How many times were we told that never happens? Believing there must be an underlying cause, we pursued genetic evaluation. The diagnosis gave my symptoms some validity. However, with the gross lack of working knowledge of this disorder, I cannot say that my experiences have improved much. I have lost so much because of HEDS. My family and I grieved the life I thought that I would have. However, I have learned so much and am stronger and more hopeful because of it. HEDS has cost me my chosen career path of music education and music therapy, along with losing a career in early childhood education. It has cost me time with my nephews, running and playing like a normal aunt. It has cost me trips and plans with friends that I will never get back. But it has given me a platform to speak and help others and let them know that they are not alone. It has given me the opportunity to show my nephews that their aunt loves them and can still be a big part of their lives, even when I have to sit on the couch with them instead of running outside. My friendships are stronger because I know who is there for me no matter the circumstance, and my family will now forever be a safe haven for other families that are just finding out that their loved ones are struggling with the same disorder that I face.
As you have learned in previous courses, EDS is a multi-system disorder. In my experience, it is also a spectrum disorder. In other words, like many syndromes, patients can present on a spectrum ranging from mild to severe with regard to symptoms and system involvement. Because of this, patients receive very mixed reactions to their diagnosis from providers, ranging from dismissive to compassionate. Let's begin by talking about some possible reasons for the barriers that EDS patients face. The first is fragmented care. Due to the multi-system nature of the syndromes and very specialized healthcare systems we have, our experience has been that the majority of specialized providers do not treat EDS in a holistic manner in which it demands. Maddie has approximately 15 different specialists involved in her care at any given time, and they are not all in the same healthcare system, with each system using different healthcare management systems. These systems, more often than not, do not communicate with each other. The patient is left to effectively communicate with every provider, making sure not to leave out any key pieces of health information from their medical history. This is especially problematic if the patient and or family has little or no medical training. In addition, and closely related to the first challenge, are the lack of available resources for EDS patients. We have traveled to multiple states, and on average, we experience at least a year delay most every time Maddie has a new complication of her EDS. Due to this variable, the pool of qualified providers, even within the specialties, is very limited. During a recent hospital stay, I asked a medical student at a major U.S. medical center what they were learning about connective tissue disorder in medical school. His response was, they mentioned it. Self-reporting of physicians or physician referral to others with expertise yields very few qualified providers in regard to these syndromes. Now add to that the limitations that some have knowing how to find these providers and or the barrier of financial resources to access them once they do find them. Many patients are on state Medicaid insurance due to disability and are denied access due to their own coverage limitations. Even with commercial insurance, we have averaged about $30,000 out of pocket each year on medical expenses, including co-pays, medical equipment, and travel. Try to imagine this. We have lived with it, and I can tell you that the standard care fails most patients with EDS. What works with most patients will not work for many with these syndromes. For example, Maddie has had more normal scans and tests than anyone I know for someone who has such severe dysfunction. Our most recent severe complications have been musculoskeletal. Almost every time we hear that her joints appear fine or nothing seems torn, all the while they're seeing an obviously disfigured joint with limited motion. We've been asked, why are you not exercising? While they see her sitting in a knee immobilizer, which she has been in for nearly 2 years, prescribed by them. As you hear in other parts of Maddie's testimony, these comments leave patients feeling like it's their fault, like they're not doing enough. Rather than feeling supported and cared for, they feel ashamed, alone, and hopeless. In our experience, we have had to keep searching and looking for providers that will help and listen and help solve our problems every time. Many times, the person helping lead us to the solution has been an ancillary provider, a support organization, or even another person with EDS.